Hey, I am Shannon Holton, Real Salty Dietitian, and as the name might indicate, I am a registered dietitian, and I currently own and operate a private practice called Sound Growth Nutrition and Wellness. That is a new venture, midlife change. Some may look at me and say midlife crisis, but really what it is just kind of a decision to shift gears and focus on the areas of nutrition that really appeal to me and spark joy in my life. What I want is an outlet for not only nutrition, but also for just general work life frustrations. I plan to post content about the nutrition science side of things, but also want to post content about my personal journey of coming to a place where I can enjoy my work and topics such as parenting. As a pediatric dietitian and a mom of 3, I have a lot of insights there that can share, and also general peopling skills. One of the things that I've spent a lot of time doing in the last 20 years of my career is figuring out how to people with people. The first video, what we'll do is I want to break down terminology. So I want to be able to share what the difference is and what makes a dietitian different than a nutritionist than a health coach, so that folks can understand my background, where I'm coming from, and build that confidence and trust in the words and the things that I share moving forward. So first of all, a registered dietitian is a licensed or registered profession that provides a medical service in a healthcare setting. We're required to be in hospitals, we're required to be in health departments, and all of those good places. But we also have background to back that up. So our coursework includes a variety of science, including biology and chemistry. We have a lot of math. We have a lot of coursework on behavior change. We also take classes on food science so that we can understand the composition of foods and really how they work in the body. In addition to that, when I think about most dietitians I know, most dietitians have so much science and background in science that generally their minor was in chemistry or in biology, because of the amount of coursework we have to take to kind of understand the not only the chemistry of food, but the chemistry of our bodies and kind of how that all works together. The registered dietitian is the only profession that is allowed to provide what is called medical nutrition therapy, which is a healthcare treatment in conjunction with your doctor or your practitioner to specifically treat nutritionally certain medical conditions. People that have chronic diseases like Crohn's or irritable bowel or diabetes or kidney disease, they all can use a dietitian in conjunction with their medical care to make their lives better, to make their bodies healthier. A nutritionist is one of the most ambiguous terms. So people can call themselves a nutritionist and have zero nutrition background. So if you are looking up for a nutritionist in your area, make sure that you look to see what their background is. You could find people that have absolutely no degree whatsoever, and they can call themselves a nutritionist as long as they put a little disclaimer on their website that says that they're not really qualified to provide medical nutrition therapy. Doesn't mean that they're all invalid. Some of them provide really great general information, but they're not going to be able to give you that specified, personalized nutrition information and advice. And then the last group, one that's really grown in the last 10 years, I would say, is called a health coach. And health coaches are often in primary care offices. They're often at health departments. They're often a part of a coordinated program, like if somebody joins a diabetes program or a weight management program, a lot of times you'll have a health coach. They generally have a healthcare background, so a lot of the health coaches I know are nurses or people with a public health degree or people with a nutrition degree that just haven't gotten their registration or license yet. So they have knowledge in health and wellness and body chemistry, but they aren't qualified to provide individualized nutrition care. So they're there to be a accountability partner, a support person, somebody who can tell you you're doing a great job and staying on track. When things deviate from that, then sometimes it's time to go back to the registered dietitian and revise a plan or come up with a different plan if it's not working. All different pieces and parts of the puzzle of our wellness side of healthcare, but just to note that there are major differences. And again, registered dietitians are the only ones that are qualified to provide that specific medical nutrition therapy. Legally, also, dietitians, because of licensure and usually state to state rules, are licensed to practice in the state they're in. So for example, I am in North Carolina, so I can see patients in North Carolina, but if I go to South Carolina or Georgia, I can only, once again, provide that coaching and that wellness from a liability standpoint. I am not able to give medical nutrition therapy unless I get my license in those other places too. Not that big yet. When we talk about what my personal background is, so I started 20 plus years ago studying biology and wanting to do something in the world of science. When I realized I didn't know what that was, I sat down, looked at the different options, and nutrition had always been an interest to me. I personally have struggled with weight my whole life, so knowing that that was something that I struggled with, I thought, maybe I should learn more about that so that I can fix myself. Maybe I can find the magic pill, magic diet. So I went down the path of learning nutrition science, and I really liked the aspects that it wasn't just science, but it also brought in the human aspects of the behavioral parts and pieces, and also the math, because I'm kind of a nerd with math, but I always thought I can't get a degree in it because I don't know what I'd do with a math degree. There's lots of things you could do with a math degree, but just saying. So I got really excited about that, completed that. I did an internship that was mostly geared towards public health, so spending time in not just hospitals, but also in state facilities for mental health and schools for food service and things like that. Then I did not get my master's degree right away. I decided I needed to make money and I needed to pay off loans and wanted to jump right into work. So I went first into the clinical care, and I thought this will be a stopping point because I really love public health. And I got into working with pediatrics in an inpatient hospital setting and just totally fell in love with that. It's where I spent most of the last 20 years of my career, and working on taking care of really sick children with medical nutrition conditions. About 5 years ago, I decided I wanted some healthcare career growth, and I went ahead and signed up to get my master's of public health online while I worked my full-time job and had 3 kids at home. So that was an amazing experience. Even though I think I slept 4 hours a night for 2 years straight, I really enjoyed learning about the whole healthcare system and kind of how I can try to leverage my profession in that. Once that was finished, I thought maybe some career doors would open for me to get into different areas of healthcare, and quickly learned that being labeled as you're a dietitian created some of those barriers. So when I really thought and stopped and had to come to, Jesus moment with myself and thought, what is it that I really want? What I want is to help the community. So I decided about 4 months ago to embark on my own journey of a private practice where I could personally impact the community. That is my personal journey, and what has made me to be the more science-minded person I am, from working in a background that's very, very clinical, but also the saltiness of struggling with frustrations of our healthcare system and the lack of support and acknowledgement as a whole with nutrition. It's better. So some people like to look at the glass half full, glass half empty, and I'm kind of like a pragmatist where I'm like, well, the glass is in the middle. So I think about the positives, which mean we've come a long way in the last 20 years of my career, acknowledging nutrition as an important piece. But the half empty part still remains that a lot of people don't acknowledge that the registered dietitian is the one that's really going to impact the health of our society. So that's where I'll leave it for now. I would love to hear comments about things that you're interested in learning, that some of the science that you would be interested in me breaking down and being able to really explain what it means versus what the title just says. And even any kind of outlandish things you've heard, I'd love to really address and get on soapboxes about some of those things. My husband could tell you, my kids could tell you, they're probably really embarrassed that I'm making videos online. But that's okay, because this is my new journey, and I would just like for some people to join me in that and to hopefully stay tuned and learn over the coming weeks about nutrition-related topics that can impact your lives, or maybe a friend's, or maybe a family member that you know is doing something really outlandish with their diet and nutrition.